I will start our recording. And again, we thank you so much for being here with us. The state of Tennessee is showing up for our Count the Kicks launch, and we are so grateful. Just want to let you know that we are discussing a sensitive topic today. Stillbirth and maternal health outcomes can raise a lot of feelings for individuals and have a potential emotional impact. And we want you to know that we support you. We want you to prioritize your emotional well-being. So it's entirely okay if you need to step away from our conversation today. Because we're recording it, we will send the slides out. We encourage you to take care of yourself and engage with the information when you can. But just want to give that disclaimer. We are so thankful. We want to give a huge shout out to the Tennessee Department of Health. The partners that we work with there are phenomenal, as evidenced by our successful webinar launch that we have today. And so we're very grateful for their support in launching this campaign across the state. And they are committed to working on reducing stillbirth and improving the outcomes using this campaign alongside of the other wonderful things that we're doing in the state of Tennessee with the maternal child health initiatives. So as I said, I'm Sarah Coleman. My background, I started out in labor and delivery as a nurse a long time ago and made a little bit of a career transition to K-12 education and completed an MPH during the pandemic. That put me back here in the maternal child health space. I'm so excited to be here. I'm the state expansion director of about 18 months. And so I've been here long enough to know that this campaign is going to be just incredible in the state of Tennessee. We've seen such great reception to this information already. I'm going to pass it over to my coordinator and let her introduce herself. I will tell you, we go by Coleman and Hybels since we have the same first name. So Hybels, it's up to you.
Hi, everybody. I'm Sarah Hybels, and I'm the State Expansion Coordinator with Healthy Birthday. I've been with the organization about 1.5 years now. My background is working with victims through a district attorney's office. I was also an employee at a shelter for victims of intimate partner violence. And then most recently, I worked in the health and wellness field, working with expectant parents and infants. So I am so grateful to be here with you today. I am so excited to see people from all over the state, all different sorts of work that you do with expectant parents. I'm so excited to be here with you and explain a little bit more about Count the Kicks and what you can do to help save babies in Tennessee.
Thanks, Hybels. We also have Dr. Ralph Alvarado here with us today. And let me just read his bio. We're going to let him say hello to you. So Dr. Alvarado joined the Tennessee Governor Bill Lee's cabinet in January of 2023. He is the 15th commissioner of the Tennessee Department of Health. Dr. Alvarado has spent nearly a decade in public service, and in 2014 was the first Hispanic member elected to the Kentucky General Assembly, where he represented Kentucky's 28th Senate District. During his service in the Kentucky Senate, Dr. Alvarado was chairman of the Senate Health and Welfare Committee, led the Substance Abuse Recovery Task Force, and was a member of the Medicaid Oversight, Banking and Insurance, and state and local government committees. Dr. Alvarado has been a practicing physician for the past 29 years, working in a variety of clinical settings as a hospitalist in primary care and at skilled nursing facilities. Dr. Alvarado has served as a medical director for the Medicare health plan operator Stableview Health and Signature Advantage in Lexington, Kentucky, and as medical director and finance chairman for Kentucky One Health Medical Group in Louisville, and as the vice chair for the Board of Quality Independent Physicians also in Louisville. From 2009 to 2011, Dr. Alvarado was chief and medical staff president at St. Joseph's Hospital in Lexington, Kentucky, and was elected to the hospital's board in 2010, serving until 2012. Dr. Alvarado earned a Bachelor of Science in Biology from Loma Linda University, Loma Linda, California in 1990, where he went on to receive a doctorate in medicine in 1994. Dr. Alvarado completed his medical residency in internal medicine and pediatrics at the University of Kentucky in 1998. Dr. Alvarado and his wife of 30 years, Dawn, have 2 adult children. So thank you. Please help me welcome Dr. Alvarado to our webinar today. He's going to give us a little bit of a welcome.
Thank you, Sarah. That intro is probably longer than what I'm going to be saying. I got to get that thing shortened down. It's had a lot of experiences. I was looking at that picture too. I think I look more like my father every day. So I'm starting to age and show a little bit there. So for those of you who heard that, I'm getting Ralph Alvarado, the commissioner of the Tennessee Department of Health. Also been a practicing physician. I've trained in internal medicine and pediatrics, attended a lot of newborn deliveries, So I'm kind of partial to making sure that we have low infant mortality rates in the state of Tennessee. Got my training at Loma Linda University, like you heard, for medical school. Then I did my residency at the University of Kentucky, and then I kind of got Kentucky-fied there. Through a long story, I found myself as a legislator and served in the Kentucky State Senate for 8 years. And then, again, through a series of events, got on Governor Lee's radar, and here I am now serving in his cabinet, and really proud of the work that's being done. And again, one of the major issues the governor wants to kind of work on is maternal and infant mortality. And that has been something that I know a lot of his budgetary kind of mark has been made in trying to improve that, and also always constant discussion with PennCare about what we can do to help reduce our rates. We know there's many ways that you could be spending your time today. We appreciate you taking time out of your very busy schedules to join us. And we're proud to be part of this partnership, kind of to launch this evidence-based stillbirth prevention program for the state of Tennessee. Perhaps in your work, you might consider a verse that I often think of, which is in Matthew 25, where Jesus says, "Truly I tell you, whatever you do for one of the least of these brothers and sisters of mine, you've done for me." And I believe the concept of caring for those of greatest need shines through the work that you do in supporting the children and the families of our state. And I often mention this to our legislators, that many of us who are people of faith, we can work and live our faith through the work that we do through the Department of Health and through these efforts. And so I've traveled to all 95 counties in Tennessee. I know that the challenges may not look the same in every community when it comes to infant well-being, but we do know that everywhere that almost half of infant deaths are preventable, and that we can have a positive impact on infant outcomes thanks to the work of folks like you all on this call. Stillbirth rate in Tennessee is at 6.6 per thousand live births. For comparison, I think the U.S. stillbirth rate is 5.8, and we think that we can lower that rate by working with you, our state partners, and Healthy Birthday, also the nonprofit organization that created the Count the Kicks stillbirth prevention program. So Count the Kicks is proven to improve birth outcomes for moms and babies. It's a simple and non-invasive way to monitor a baby's movement once a day in the third trimester of pregnancy. So thank you for spending the next 60 minutes with us and learning about how you can implement what you're going to learn today in your hospital, clinic, or organization. And over the next hour, we're going to discuss how we can work together to reduce the stillbirth rate and improve birth outcomes further for families across Tennessee. Again, thank you all for what you do, and thanks for the time, Sarah. Thank you.
Thank you, Dr. Alvarado. We truly appreciate the support that you've given us. So wonderful way to introduce us. So we're going to play this video. If you've not heard of Count the Kicks, we'd love to introduce, like, what exactly is it that we're going to be talking about today? And this is our story that was shared on Good Morning America.
We have a healthy baby girl, and we could have had a burial instead.
Ruby is lucky to be alive, and her mom says that's largely thanks to an app. The free app called Count the Kicks aims to prevent stillborn deaths by helping moms record their baby's movements.
You can just tap the baby's footprint every time you feel a movement. A movement could be a kick, a roll, or a jab.
Used at the same time every day, the app tracks how long it takes to reach 10 kicks, helping mom learn what's normal for her baby.
And we also send calendar reminders and text reminders so that moms are reminded to do it once a day in the third trimester.
For the ECOFs, everything was going smoothly until one day last month.
The kicks were not happening as frequently as they usually did. And when she did move, it was really like soft, subtle, not like hard kicks like normal.
Emily knew from the app that her baby normally kicked 10 times in under 10 minutes. So when she only logged 3 kicks in an hour, she rushed to the hospital.
All of a sudden, they came in and said, "You're going to have an emergency C-section."
The umbilical cord had wrapped around the baby 3 times, limiting her movement. Doctors delivered Ruby just in the nick of time.
Not only has Ruby been saved, but potential generations have been saved.
So that's a little bit about our program, and we're going to get into this. I'm going to launch a poll. We'd love to see how many of you have heard of Count the Kicks before you attended our webinar today. So I'm going to let that run while I let Hybels introduce some of this information.
Thank you, Coleman. All right, so like Dr. Alvarado said, what is Count the Kicks? We are a highly effective evidence-based stillbirth prevention program. We were founded here in Iowa about 15 years ago by 5 Iowa women that each experienced a stillbirth or infant loss. And we've developed a proven early warning system for expectant parents and have saved lives in 36 states and 5 countries so far. And what we want you to know is our program is so easy to use. It is plug and play. It's easy for you to share with expectant parents. And in this webinar, you're going to learn about the tools and the resources that you need in order to implement Count the Kicks in your work setting. So before we go too much further, let's discuss the tragedy of stillbirth in numbers. So first of all, the CDC defines stillbirth as a loss of a baby after 20 weeks of pregnancy, and this is a public health tragedy. So stillbirth is a lot more common than people think. We talk about SIDS all the time. We have the Back to Sleep campaign, but people are not talking about stillbirth. And the fact is that 1 in 175 pregnancies will end in stillbirth in the United States. That means today, 60 babies will be born still in the United States. And I just like that to sink in, think about that. 60 babies today will be born still in the United States. And additionally, there are disparities that exist that are unacceptable. So as you can see in this slide, it's clear that there's vast differences in the stillbirth rate affecting Black, Indigenous, Native Hawaiian, and Pacific Islander families. And these exist and persist and need to be addressed through systems change. And it's important for us as an organization to this conversation to understand the stillbirth impact in your state and those areas that need this messaging the most. So take a look at this data on the screen. And I want you to note that these numbers are from the CDC, or from CDC Wonder database. And this is based on a 5-year average. And the most recent information we have is from 2017 to 2021. So on average, Tennessee loses 539 babies every year to stillbirth. But we believe with statewide implementation of our Count the Kicks program, we have the ability to save 172 babies every year. And that is with you implementing our Count the Kicks work with the expectant parents that you serve every day.
Hold on, I got a little bit of a lag today. Hopefully we're gonna keep the internet alive. So I've shared the results of our poll. So this is a great audience for us today. Many of you have not heard of us before, heard of the campaign. So this is a great opportunity for us to introduce the data to you. Dr. Alvarado talked about these fetal deaths that can be preventable. What we don't know about stillbirth is we don't know exactly why it occurs. There are some correlations that we can make. We can learn things after birth. Some of you are here from femurs. You're probably more aware of that information than even I am. We learn from the stories that we hear. We learn from the physical evidence that's gathered. And so you can see on the screen, here are some of the most common reasons that stillbirth can be attributed to. But again, we don't know everything. I'd also like to point out that an epidemic is occurring across our country with congenital syphilis. And so this has, we have a laser focus going on learning more about what congenital syphilis, when left untreated during a pregnancy, what impact that might have on a mother and baby. So on that birthing dyad, what is the impact that can happen? So these are just some of the reasons that stillbirth can occur, but again, we don't know everything. One thing we do come away knowing strongly, and we hear from the case reviews, is that there is a change in a movement pattern. And that's really what we're going to get into today, is talking about identifying changes in fetal movement. And how we do that is through our educational campaign. So this is just a preview. If you haven't had a chance to see our materials yet, these are what we call our at a glance educational materials. They're one of our more popular series. And you can see it's meant to be very fun and inviting. The color brings you in, the illustrations bring you in. It's based a little bit, maybe it looks familiar to you, Dr. Seuss. We have a permission to use kind of that font and whimsy from Dr. Seuss's Widow. And that's an important aspect of our campaign, is just having these materials in a way that meets the community where they are. So it's very heavy on the visual information. We'll give you a chance to see other materials, but want to start off right away with showing you just what this campaign looks like if you are an expecting parent. So what are we doing to reduce disparities? Hybels talked a little bit about that in the data. One thing that's so great, our app is completely free. We're going to give you a walkthrough on that app, but it's also available in 21 languages. So when someone is using this, we hope that we have met them and we've made this accessible. We've made the information accessible to them. We constantly are looking at our materials and receiving feedback about our materials, adjusting them based on that feedback. We do a lot with video. educational materials, frequently asked questions. We're constantly looking at ways that we can be a part of narrowing the gap when it comes to culture, language, and ethnicity instead of widening that gap. We do a lot of community outreach, and we engage with individuals that share their story with us, just like the one that you're about to hear. So you're going to see and you're going to hear from this mom what happened in her story and how she connected with resources.
I am so blessed that she got here safely. And I'm so glad I listened to myself this time, and I listened to my body, and I counted my baby kicks. Count the kicks I mean, it helped. It really did. It saved my baby's life. It really did.
She was like, it's a good thing you came when you did, you know what I'm saying? Because if you wouldn't have, you know, we probably wouldn't be having the same outcome. I think about it every day, like, oh man, what if, you know, what if?
And so one thing I want to highlight is that every person that is here today, you are really important to this conversation. You are critical to sharing this information with individuals that you come across every day. We know that it takes people a repeated exposure to retain information. There's the educator in me coming out in multiple different ways. And that's really why we need everybody to promote this campaign and to talk about stillbirth so that we can have an impact on this. And it doesn't have to be a silent crisis. We hear that term oftentimes from expectant parents who've lost children before. They talk about how this was something that was not shared with them by their providers, by home visitors, by anybody in their network, their social communities, because people are just afraid to talk about stillbirth. And we kind of want to bust through that door today and encourage you to confront questions that you've heard and clear up misconceptions. So let's get started right away with the research and the evidence. We are based in Iowa. Our five founders, the women who founded the Healthy Birthday organization, all experienced stillbirth or infant loss, and they didn't want anybody else to be a part of their team. And so what they did with their experience was to go out and see, well, why didn't anybody talk to us about stillbirth and what's being done about stillbirth across the United States? They came across this study. We refer to it internally as the Norway study. And you can see Dr. Ruth Fretz is circled in red there. She is an original researcher from this story, and she advises us today on our work. So here's what happened in Norway. These researchers came together. They went to hospital systems across the country in Norway. So thinking birthing hospitals, OBs, midwifery practices across the country of Norway. They wanted to do an education campaign to help expectant parents know what to expect with fetal movement. How did they learn what their pattern was? So they came across this educational campaign. They didn't come across it. They designed this educational campaign where they were having providers share information about counting every day at the same time for every pregnancy during the third trimester. So those are kind of the tenets that we hold to when we talk about fetal movement monitoring. This should be done for every pregnancy, if it's pregnancy 1 or pregnancy 5 for mama. Every pregnancy, you want to count every day at the same time. So we're looking to establish a pattern of movement. So, and I just noticed this caught my attention in the chat. It's okay if patients start earlier, but what we know is in that third trimester, expectant parents really can identify the movement and distinguish that from the movement of their own body or the physiological processes of their own body. And Hybels is going to get into that. Back to the Norway study though, these physicians, the midwives across the country used this educational campaign, and they told the parents, if you notice a change in this movement after you've established this, go to the hospital right away so that we as the providers can intervene. So we can make the decision, we can look at the data, we can look at what's happening inside the body and make a determination what needs to happen with the baby. So all of that being said, they saw a 30% reduction across the state, across the country of Norway. So our 5 Iowa founders said, well, let's try that here in our state. And they went and created the Count the Kicks campaign. So this is the data to 2023, the most recent data that we've had. That red line is the national line, the national trend data for stillbirth rates. The green or teal colored little dots there, that's the Iowa rate. Now you can see some differences. We have things that happen like a pandemic, a syphilis outbreak, other health outbreaks that happen. Maybe it's a year where we've had record numbers of individuals who are smoking or something else, some other physiological condition is happening. But what you can see is a trend line that continues down with our campaign. We also want to highlight that, and it was in the video here, we have seen a dramatic reduction in Black stillbirth rates across Iowa during the first 5 years of our campaign. So all of that being said, we are continuously working across Iowa and across the United States to have this impact. And we learn every day from the data that we gather from our partners about what we need to do and things that we can add to get the messaging out. So a little bit more about this research. We've been published in both the British Journal of Obstetrics and Gynecology and the American Journal of Obstetrics and Gynecology. When I share the slides, these links will be embedded for you to take a look at the research for yourself, or you can scan the QR codes here today. But essentially, these 2 studies are the foundation for our program, and they prove the evidence is there that the reduction was clear. So in particular, the BJAG study looked at states around us that did not have implementation like Iowa did of the Count the Kicks campaign, and there was a dramatic decrease. Like every 3 months, there was a reduction that was happening in Iowa that was not being repeated across other Midwestern neighbor states. So this research is really important. In addition to this, we've just recently, and I am an author on this study, this is being published in November. So those of you who read the Journal of Maternal Child Nursing, excuse me, we talk about systematic implementation. So if you are someone who is in a clinic, a provider, maybe you're here represented in MCO today, would love to have you read this article to just share with you what a state implementation looks like and how we strengthen the implementation by standardizing the things that we do across that program. That's exactly what we're doing here in Tennessee. We are standardizing the implementation of fetal movement monitoring as a practice. Hybels?
Thank you. Give Coleman a little break here. So I'd like to introduce you to Mabel. Mabel is a Count the Kicks baby save. And Mabel's mom, Megan, says the only red flag that there was a problem with my pregnancy was my daughter's change in movement. I'm so grateful I had the concrete data from the app, which gave me the knowledge that something was off and the confidence to advocate for my baby. So we're just so grateful that Megan was using our app, that she trusted her intuition, that she got checked out, and then Mabel was able to come into life safely. So we're so grateful for that. And we'll talk a little bit more about the app, about movement and all of that. There's lots of great questions in the chat. So thank you for all that. We'll get to the logistics of counting kicks here in just a moment. So as a part of the Hear Her campaign to reduce maternal mortality in the U.S., the CDC has listed 5 urgent warning signs for expectant parents, and the importance of paying attention to baby's movement is one of those key markers. So the CDC knows that paying attention to baby's movements not only acts as an early warning system for babies, it's also a critical alert to mom about issues that she may be having within her body, her pregnancy, and her health. So just like when adults don't feel well, if you are sick or have COVID or the flu, your movements are going to change, and babies are just the same. And we'll talk about this a little bit more here in a minute. But when we are sick, then our movements change. We're laying on the couch, we're in bed, and babies do the same when they're not well. They're conserving their energy. And that's why a change in baby's movements is sometimes the early and the only warning sign that the baby may be in distress.
Yeah. We recently collaborated, those of you who are nurses, we recently collaborated with A1, and this is the most prominent OB Nurse Association in the United States. We've published a practice brief on reduced fetal movement. So the brief aligns seamlessly with Count the Kicks. In fact, it states very explicitly that focused assessment and management of decreased fetal movement or significant changes in the fetal movement patterns by perinatal clinicians is essential for improved fetal outcomes. So we invite you to read the practice brief by scanning the QR code. And if you are a public health professional, we recently, HRSA revised the outcome measures, and they have announced that there is a new national outcome measure solely focused on stillbirth. So you can see, I've linked it up here for easy access. Those of you who are taking a look at needs assessments right now, there's a specific call to engage in stillbirth prevention programming that is on page 91 of the 10th edition of the guidance and forms documents. So research indicates too, we get asked a lot about anxiety. And so this is a really important point for us as we look at our data that we gather from the app. We do have an opportunity to engage with app users. We don't sell their data. We do not in any way, shape, or form sell their data. But sometimes we'll ask them questions. And we have a research study that's been published based on this information. We learned that 84% of app users stated that regular tracking was associated with feelings of bonding. So those of you who are home visitors, working in early elementary ed, those kinds of connections, early intervention, this is another great aspect of the Count the Kicks campaign, is that this can be done as a family unit. So if there's little babies, they're not babies, little toddlers, they can help mom do some of that fetal counting on the app. There's definitely bonding that can occur with baby in utero and also older children. So experiencing that. And we also know from our app survey that 77% of app users report that they feel less anxious because they understand more about their babies and they get in tune with those patterns. So really important movements there. We've also published a paper. So we are focused a lot on stillbirth today in our launch. You're going to hear all about that. But maternal mortality and morbidity is also something we keep our eye on. And the reason why is because more than 15% of maternal deaths within days of delivery occur in a woman who experienced a stillbirth. So again, letting that sink in, that is a really important statistic that we need to take seriously and think about when we have an expectant parent who delivers a stillbirth. We still need to keep our eye on them. That's really important. So this article goes through some of these lived experiences from individuals and just shares how they spoke up about a change in their baby's movement. It not only saved their baby's life, but also identified and addressed pregnancy complications that put their own life at risk. So what are the benefits beyond stillbirth prevention? Really briefly here, we know, again, the link between maternal morbidity and mortality. We can increase the gestational age. If we're able to monitor baby and we know that everything is going well, then we leave baby there, right? So we're reducing the NICU stage and increasing gestational ages. So another important aspect of this campaign. So I'm going to transfer it to Hybels. I see a lot of questions coming in. This is so wonderful. I'm going to take a look at them while she talks about how to have the fetal movement monitoring conversation.
Yeah, so many great questions and stories in the chat. So thank you so much for sharing those with us. So, okay, so let's talk about how to have a movement monitoring conversation. So this will go back to some of the questions that have already been asked. So again, why does movement matter? So movement is a very important way that baby is communicating before they are born. And again, this is sometimes an early and the only warning sign that something may be wrong with baby. So again, think back to the last time you had the flu or COVID or a bad cold. Again, your movement's going to change. Your activity level changes. We slow down when we're not feeling well, and babies are the same. Their movements become weaker during a time of distress because when they're not feeling well, they're naturally preserving their blood flow to vital organs such as their brain and their heart to conserve energy and self-protect. So when should we start counting? ACOG recommends to begin counting at 28 weeks of gestation or 26 weeks if considered high risk or pregnant with multiples, because this is when research has indicated that an established movement pattern has begun that expectant parent can feel and track. And then what movement should we count? We want to be sure to count all those movements, every roll, kick, jab, swoosh, push, any movement except for a hiccup because hiccups are involuntary. Okay, so we've talked about why it's important, when to count, what to count. Now let's talk about how to count. And it's as simple as these 5 steps. So number 1, we want to monitor baby's movements with our free Count the Kicks app. We also have a web-based kick counter, and we also have printable kick counting charts that are available for free on our website. And we'll put links to those in the chat here in just a minute. Those printable charts are available right now in 12 languages, and there are more coming soon. So keep checking back for that. Number 2, we want expectant parents to count their baby's movements every single day in the 3rd trimester, preferably at the same time when the baby is most active. And again, going back to what Coleman said, every pregnancy is different, every baby is different. So counting every day for every pregnancy in the 3rd trimester. And then the goal is we want those expectant parents to learn how long does it take that baby to get to 10 movements. So their first pregnancy, their baby may have taken 10 minutes to get to 10 movements, but their second pregnancy, it may be closer to 15 or 20 minutes. So what is normal for that baby? And then we also want to rate the strength of the baby's movements from fluttery to fierce, and the app will give an option for that. And then after a few days, the parent will begin to see that average length of time it takes the baby to get to 10 movements. And then number 5, if they see that there's something different in their data, if it's taking their baby a lot longer or it's rapidly quicker that they're getting to those 10 movements, then they have data in hand to take to their care provider to say, hey, I want to get checked out. My baby's movements are different. So now let's talk about our Count the Kicks app. This is our free Hallmark tool, again, available in 21 languages on Apple and Android and Apple Watch. You can set daily reminders to count the kicks, and you can download your history as well to share with a provider or family member. So it's so easy to use. We want everyone to become a registered user because then your data is saved. And that's how that expectant parent is going to start to see the graph like you see on the screen here. So to start a kick counting session, we want that parent to lay down, relax, just take that time to bond with baby. Maybe involve a partner, a family member, or a sibling in the kick counting session. So you want to tap the blue footprint as soon as you feel one of those pushes, kicks, or jabs, the timer will begin. And then you tap the blue footprint anytime you feel another movement. After 10 movements, the timer will stop. Again, the app will ask you to rate the strength of the baby's movement from fluttery to fierce. And then after a few days, again, this graph, this great visual representation of baby's movements is going to show up on the app screen. So again, if there's a big spike or dip in the change in baby's movements, then that parent has data in hand that they can take to their care provider. We kind of call this a data download for that parent's intuition. So they can show this to a care provider and explain that they want to get checked out. So please, we want you to download our app. We want you to play around with it. Realize how easy it is to share. Show it to expectant parents when you're working with them every day. Feel free to do that and learn how easy it is to use. Another resource that we have on our app is our Find Local Resources page. So registered users can search by zip code for free and reduced cost services like diaper banks, dental care. We were just looking at some data from this today that shows people are really looking for diaper banks and formulas and food resources. So we want to connect people with those resources before baby is born. And just please know that this is a completely free resource that someone can use through our app.
Do you mind, Hybels, if I jump in and answer a
Absolutely.
question?
Please.
So I want to go back here because somebody put a great question in the chat. Do we want to notify the doctor if things are faster, stronger, or only weaker and less frequent? And the answer to that is both. And we've heard this story both ways. We've heard from an expectant parent who said she felt the movement speed up in intensity. Something was definitely not right. It sped up, it got real fast, almost felt very frantic. And when she went in to get checked, the baby was in critical distress and needed to be resuscitated. So it's both. Sometimes it's a slowing of movement. It's just the aberration or the change in the regular pattern is what we want expectant parents to be aware of. But I thought that was such a great question to what Hybels was talking about. I just wanted to insert that there. So thank you for letting me butt in just a little bit.
Glad you did. Glad you did. Okay, so let's watch a quick video now to see how easy using tools from Count the Kicks is for expectant parents.
Whether you're counting on the go,
आराम से, घबराइए मत.
your baby's movements matter.
Les mouvements de votre bébé comptent.
Monitor your baby's kicks, pokes, jabs, and rolls once a day.
Todos los días.
Oh, I missed it. Oh, you guys, I'm sorry. Hold on, let's restart that.
Whether you're counting on the go,
आराम से, घबराइए मत.
your baby's movements matter.
Les mouvements de votre bébé comptent.
Monitor your baby's kicks, pokes, jabs, and rolls once a day.
Todos los días durante el tercer trimestre. C'est l'occasion de communiquer avec votre bébé et d'apprendre ce qui est normal pour lui.
Bond with your baby.
Crea un vínculo con tu bebé. सशक्त महसूस करे. Sentez-vous autonome.
Confía en tus instintos.
Trust your instincts.
Ve al hospital de inmediato si los movimientos de tu bebé cambian.
L'application gratuite Count the Kick est disponible dans plus d'une douzaine de langues.
Application download करें or visit countthekicks.org for more ways to count.
देर न करें, आज से ही गिनती शुरू करें.
No tardes, empieza a contar hoy.
Ne tardez pas, commencez à compter aujourd'hui.
Don't delay, start counting today.
Sorry, I messed that up. I was.
All good, all good. Okay, so now let's talk about those materials a little bit more. So there are links. Sorry about that. There is a link in the chat to order materials and for our principal kit counting chart. So how do we get that 30% reduction rate in Tennessee like we have in Iowa? It is through these materials. Thank you again to the Tennessee Department of Health. They have provided the funding to make these materials free for all providers in the state of Tennessee. So we have these brochures. We again have the picture-based at-a-glance materials. We also have the traditional materials, which are more text-based. We have posters, app cards, brochures. We also have wristbands, which we will talk about in a moment, and magnets. So we are going to give you some time right now to go to our website and place an order. Please bear with us if the website is slow. There are a lot of people on this call, and so it may just take the website a little bit of time to catch up. So anyone who orders by midnight this evening will be entered for a drawing for a $25 Amazon gift card. We're going to be giving away 4 of those to people that order materials today. So again, Coleman's going to play some music. We are going to give you some time. Go to countthekicks.org, click on the state of Tennessee, and you'll see the amazing materials that are available for you for free.
Before I start my song, I see some Virginia folks have joined us. Yay! Thanks for being here. And all you have to do is in order materials up there in the top left part of your screen, just change the state. And thank you for being here. So yes, now it's let's see if the music will work now. There we go.
Sunshine, she's here. You can take a break. I'm a hot air balloon that could go to space. With the happiness is to you. Because I'm happy. Clap along if you feel like that's what you want to do. Here come bad news, talking this and that. Well, give me all you got and don't hold it back. Well, I should probably warn you, I'll be just fine. No offense to you, don't waste your time. Here's why. Because I'm happy. Clap along if you feel like a room without a roof. Because I'm happy. Clap along if you feel like happiness is the truth. Because I'm happy. Clap along if you know what happiness is to you. Because I'm happy. Clap along if you feel like that's what you want to do. Hey, go. Bring me down, can't none bring me down. The love is too high, bring me down, can't none bring me down. I said, bring me down, can't none bring me down. The love is too high, bring me down, can't none bring me down. I said, clap along if you feel like a room without a roof. Clap along if you feel like happiness is the truth. Because I'm happy. Clap along if you know what happiness is to you. Because I'm happy. Clap along if you feel like that's what you want to do.
Oh, you're muted, Coleman.
I'm just going to pause this for 1 second. We're working really hard to get the website to pick up with your orders. We want you to know, please, please, please place them today. We're definitely going to open this window, but we're working real hard. I'm going to let this song finish out while I try and troubleshoot on this side.
Because I'm happy. Clap along if you feel like a room without a roof. Because I'm happy. Clap along if you feel like happiness is the truth. Because I'm happy. Clap along if you know what happiness is to you. Because I'm happy. Clap along if you feel like that's what you want to do. Hey, go. Bring me down, can't none bring me down. The love is too high, bring me down, can't none bring me down. I said, because I'm happy. Clap along if you feel like a room without a roof. Because I'm happy. Clap along if you feel like happiness is the truth. Because I'm happy. Clap along if you know what happiness is to you. Hey, hey, hey. Clap along if you feel like that's what you want to do. Because I'm happy. Clap along if you feel like a room without a roof. Because I'm happy. Clap along if you feel like happiness is the truth. Because
Okay, well, we wanted you to be happy. We're working on that. The response, like I said, is overwhelming. So we will keep working, troubleshooting this. We have our team troubleshooting it right now. But know that you can always order materials, but for those gift cards, we will honor those for 24 hours. We'll pull a random winner from the 24 hours. So, all right, sorry about that, but we're going to talk about implementation while we see if we can get that, if we can get the website back up going. And yes, you're absolutely right. It's an amazing problem to have. We're absolutely with you on that. And I want to highlight, there's a story in there, or someone made a comment in there. I think it was a midwife that said, you know, I'm educating about fetal movement monitoring. Is every provider not doing that? And the answer is no, they're not. And we wish they were, because that would probably help with getting the word out and have a reduction in stillbirth rates. So let's talk about what this means and what this looks like. So the power of providers, just to illustrate what that midwife, thank you for sharing that comment, because it's absolutely underscores what we're talking about here. Back to our app users, when we have surveyed them, 87% of the app users tell us that they would contact their provider about a change in their baby's movement if their healthcare provider encouraged them to speak up about a change in movement. So if we're getting the message to them that this is important, providers want to know if they're noticing a movement, they'll do it. The expectant parents will do it. They will feel like they have the data and empowered to have that conversation. So that's really an important highlight to make. And I can't tell you how many times I have seen that in OB triage as a nurse, or I've heard that in my social circles about people that say, you know, well, when was the last time you felt their baby move? And they can't speak to that. They don't know. They don't know what's regular. And so that in itself can create some anxiety, right? Not knowing what your baby's normal pattern is. So when we have that information, that conversation looks a lot different. So what can this look like across your system? Let's talk about points of access. And I love that Dr. Alvarado was right in front of that with his comments this morning. Every single person can be a point of contact for an expectant parent and can give this information. So whether that's in the discharge process as someone is leaving an appointment, and those of you who are working in community organizations such as WIC, this can be a part of that point of contact with them and providing the education. It's very simple to say, have you been tracking fetal movement? That's a really important start to the conversation. So training for the team, this webinar is being recorded today. So you can absolutely take this back to your teams, this recording. You can take a portion of this recording and share it for professional development. We are happy. You can email me. Hybels will put my email in the chat. I wish you would email me. I want to meet all you wonderful Tennesseans that are working so hard. We would love to have contact with you and training. If you have points of, you know, organizational meetings or monthly collaborations, if the femur teams are getting together to do quarterly education, we'd love to be a part of that. And we don't need to do an hour webinar. We can do 15 minutes. We can just answer questions. Let us know. We'll really tailor something to you. As far as intake and the after visit summary, so those of you who are using electronic health records, we have the ability to share with you something that can be put into your EHR. We've piloted it here in Iowa and across the United States. So we have some options for that. Email us if you're interested. The very fun place that somebody can sit and scroll on an app is when they're waiting for a doctor or provider to see them, or maybe they're waiting for some lab work and they're enjoying that fresh, delicious glucola. As they're sitting there waiting, encourage them to download the app and get familiar with it, especially if it's one of those early on appointments. Have them mess around on the app and just look for the resources. Take the social determinants of health survey so that they are connected to resources. There's lots of different points of contact that can happen. And if you have a waiting room and you love like some of that beautiful messaging to play on the audio when people call in, or they're sitting and they want to watch videos, you have like, you know, the advertisements that are going on or things about programming, we have videos that you can put on. All of the stuff that you're seeing here today, this is free and this is available for you to use. And our social media content, that's another place where we share lots of provider information, parent-focused information, our Count the Kick social media. You can reshare all of that. That's all free to you. So we have a lot of free resources. Let's keep this moving and talk about misconceptions, because I brought that up earlier, that this is a really important thing that you can do. So I will launch the poll to see, maybe I'll launch the poll. Maybe that'll crash the website. Maybe I won't. Why don't you put them in the chat? If you have heard questions about fetal movement monitoring, such as this misconception, my baby should get 10 kicks in 2 hours. Okay, so I went to nursing school. I feel kind of sad that Dr. Alvarado was like 30 years. I graduated from nursing school in 1998. So I heard this in my education. It's just making me know how old I am. My baby should get 10 kicks in 2 hours. So in nursing education, this is what I was taught. And I'm sure there's some nurses here, they were also taught that 10 kicks in 2 hours standard. Well, the thing is that may be standard for one baby, but it's not for every other baby. Your normal may be 5 minutes. You could get 10 kicks in 5 minutes. Somebody told me in a webinar a couple of weeks ago that they could get 10 kicks in 1 minute. She was like, flat out, no joke. So just knowing what is normal for your baby, and remember, this is every pregnancy. So it's not just, okay, I learned how to use the app with the first pregnancy and now I'm done. Now I know what I'm doing. No. We want you to do this with every single pregnancy because every baby is going to kick differently. And to this whole, like, this is a misconception because current research shows just that. Current research shows that parents should work to understand the normal amount of times each day it takes their baby to get to 10 movements. So I'm sorry, I went ahead of Hybels a little bit here and got carried away with this, but I wanted to answer like to that question that was put in the chat. So I'm going to let her talk about the rest of the misconceptions now. So Hybels, jump on in.
Oh, good. First of all, the website is back, so place your orders, please. Sorry about that. We are just so excited about all of you being here with us today. So please take the time during the webinar or maybe after here in a couple hours to place your orders. So another misconception is if my baby isn't moving, I should drink something cold or eat something sugary to get baby moving. So let's go back again to think about when you're sick, when you have a cold, the flu, COVID, whatever it may be. If you drink a lot of coffee or Mountain Dew, your movement's going to change, right? You're introducing a lot of sugar or caffeine, but that's an intervention. That's a false representation of how you're actually feeling. So again, research has moved away from this idea that using sugary drinks is a good way to get baby moving. We want to count those kicks without interventions like juice or candy. And if baby isn't moving like normal, we want parents to speak up to their provider right away. We have heard many stories from expectant parents where minutes and hours matter when it comes to stillbirth. So we want those expectant parents to speak up right away if they notice a change and not use any of their interventions. Okay, so we talked about some misconceptions, and we know that there's a lot of information out there, and we know that one place that people are getting a lot of their information is online and through social media. And we want you to feel free to share any of our Count the Kicks messaging on your socials. Please get the word out about our programming. And we'd like to take a moment to share this video. This is Jen Hamilton. She's an influencer and a labor and delivery nurse. And we woke up one day last fall and she had posted this video without any prompting from us, and we're so grateful that she did. But she really focuses here on this video about dispelling the common myth of using at-home Dopplers. So let's watch.
Did you know that there's an app that can prevent stillbirth? Studies have shown that the most reliable indicator for an intrauterine fetal demise or stillbirth is a change or decrease in fetal movement. Getting to know your baby's movement and letting your doctor know if you have any changes is a great way to protect your baby. You don't need an at-home Doppler, and in fact, I would highly discourage you from buying one, because sometimes what happens is you can notice a change in your baby's movements and you can put on the Doppler and hear a heart rate and be like, whew, everything's fine. And if you were put on a monitor where we could see what your baby's doing, we would see fetal distress. This is a baby that's doing great. This is a baby that might not be doing great. And this is the baby that's definitely not doing great. But guess what? Every single one of them has a heart rate around 150. And with just hearing a Doppler, we don't know which one of these is your baby. There's a free app that you can download called Count the Kicks. It is a way that you can monitor your baby's movements, and it'll help you figure out if you might need to go get medical attention. I don't work for Count the Kicks. I get $0 for telling you about this. I just think that this is genius. They were able to decrease Iowa's stillbirth rate by 32% in the first 10 years of the Count the Kicks campaign. So please, take a few minutes each day and just pay attention to what your baby's doing. And if your baby's doing something wonky that they haven't normally done before, come see us. We would so much rather you come in, we monitor your baby, we maybe do an ultrasound, and we let you know that your baby's doing okay, than for you to not come in and your baby not be okay. You aren't bothering us, okay? We want you to come in. That's what we're here for.
You're muted, Coleman.
Boy, this is a day for me. Okay, we're going to get you out of here. We just have a couple more slides. So familiarizing yourself is a really important step. Hybels has asked you to download it. Just practice troubleshooting it. It's really not that hard, but sometimes getting into the resource menu That's where all those resources that are so great are listed there. Ordering materials, you guys are seeing how to order materials today. Make sure that if you're working in an office or a practice, that everyone is able to know where to go to get materials, and maybe designate someone to keep their eye on it. Make sure you're having accounting conversations at every touch point in the third trimester. It's really important that every time somebody sees that message is getting through and as a reminder. I talked about the entire staff knowing about the campaign. That's really important. Debunk misconceptions. We've just gone through a few. We actually have an FAQ on our website with a whole lot of them. So encourage speaking up. And if you've heard of something that you're like, I bet Coleman and Hybels haven't heard this one, send it to us. We'd love to help you with that. We'd love to be aware of those misconceptions. And then remembering that hours and minutes matter in preventing stillbirth. So I'll just take this opportunity. If you are in a maternity healthcare desert, so parts of the state of Tennessee that are rural, think through what your response will be as a provider, or how can you influence the conversation with a provider to think through if someone has reduced fetal movement, or maybe, as we talked about before, a change in their fetal movement pattern. Do you want them to call into an office and sit on hold waiting for a nurse who is super busy and trying to help all the patients today? Do you want them to sit on hold and wait for that phone call, or do you want them to go right to the hospital? Like, what does the protocol look like? Is that if it's going to take her 2 hours, do we want 2 hours of travel plus 2 hours to sit on hold? Just think through that conversation and what that means for your practice. So Hybels, you want to tell them about resources, and then we'll let everybody go. We'll check for questions.
Sure. So again, go to the website, place your orders. It looks like some things are already out of stock, so we will do our best to get those back up for you. So please keep checking back to our website in the coming weeks to place your material orders. And again, keep checking back. Again, like Coleman said, if you are running out of materials, put somebody in charge in your office or set a calendar reminder to restock those materials in your office. Again, thank you to that partnership with the Tennessee Department of Health. We will do our best to keep materials available for free online for you. So I will pass it to Coleman so she can talk about our wonderful movement monitoring bands.
Yeah, so our bands, which apparently are out of stock, we'll work on getting that fixed for you. But if someone doesn't have access to a smartphone or reliable internet, this is a great option. As you can see in the picture here, you wear that black little slider goes, the band is numbered 1 through 10. That black slider moves across. So every time a person feels movement, they're just going to slide that banner. So if they're counting at the same time every day, the only thing they have to remember is, what time did I stop counting? And they can journal that. They can put it on the printable kick charts. They can enter it in the app later. This is really important. We've heard from people who work on the line. Maybe they're a teacher in the school when they're, they started their kick counting in the summer, and now, oh no, that conflicts with like PE or something, or art class. Like, there's ways to count, and we just want to increase the opportunity. So this is a great opportunity for folks who have limited access for whatever reason it is. We also have a CE training. So if you're interested, so today you're getting this information. We're not doing any kind of registration, participation certificate for that. But if you need CEs, this is your option. You can get 4 CEs. You can get really into the weeds of the research. So that's a great resource. And then I think I put the link to this in the chat a little bit earlier. Our digital resources are free. You can do everything but embed these. So you can share these digitally. If you're a doula, this is a great opportunity to just email, like, how did I count again? Share this with your patients. If you are in a healthcare system and you're interested in embedding, that's an email conversation with me. Let's talk about what that looks like. But this right now is free on the website under digital education, same place where you go to find those printable charts. That's a brand new option. And for those of you who are asking about languages that are not yet in Tennessee printed resources, this is one of those resources you can get for free. Our social media accounts are hopping. So join us on those social media outlets to learn more. If you're interested in legislation and advocacy, Healthy Birthday is a place for that. We also share our baby saves there. And then our Count the Kicks, that's more expectant parent focused. And so you can see opportunities to reshare our content there. We have a very active social media manager who's extremely good at her job. So with that, we will stop sharing and stop the presentation and just see if there's any questions that we haven't picked up in the chat. Otherwise,